Hi, everyone, and welcome to today's webinar. You're probably here because, like many employers, you're feeling the pressure to keep up with the changing demands from your employees. Employers have had to navigate this vastly different environment, reacting to the uncertainties and challenges the pandemic has forced upon all of us. Organizations immediately had to adapt to new strategies to not only do business, but also support employees. And leaders had to quickly think about supporting employees in a new way. Well, how well did your organization respond? Did you adapt to new technologies or delivery modes? And who were your well-being champions and partners? And were they able to rise to the occasion? During today's webinar, you're going to meet a few members from our dedicated well-being services team, and they're going to share some stories about how they were able to partner with their clients who, just like you, were struggling to adapt to evolving workplace demands, and how they managed to develop versatile programs that not only resonated with participants. You're also going to discover how to create a flexible and personalized well-being program, get fresh and innovative well-being ideas, develop a plan to engage diverse populations, and you will learn how to navigate new well-being challenges. You just got a sneak peek there, but to introduce myself, my name is Julie Mallory. I'm the Senior Events Marketing Manager here at WebMD Health Services, and I'm going to be your moderator for today's one-hour webinar. Before we get started, I have a few housekeeping things to go over. First, we're going to be covering a lot of information today. And this webinar is being recorded, so if there's something that you don't catch, you want to go back and see it again, you will receive the recording in your inbox in the coming days. So just be on the lookout for that, and you can also share it with your colleagues. We're also going to have some time at the end of today's webinar for a Q&A session. So if any questions come up during today's webinar, feel free to just ask your question, and we will have time at the end. And then also following today's webinar, there's going to be a survey that's going to pop up. And we use this information that we get from you, we use when creating future content. And so it's really important for us to hear from you. It's going to take less than a minute to complete, and we really hope that you'll just take the opportunity to finish the survey. As I mentioned, this past year has so much has happened that's truly transformed the way that we work. But I really want to focus on the positive that's really evolved from it, right? We're starting to see this shift from a more supportive approach to management. As work and life become one, we've seen a shift to boost team engagement through online meetings and allowing concerns to be voiced, and also finding new ways to make people feel trusted, energetic, creative, and reliable. We're also seeing trust and respect as the new norm, whether it's with coworkers or your leadership team or your commitment to employees. Really having that visibility into what is going on in your organization, especially when working from home, is so important. We've also seen the shift with new benefits or enhancements, an uptick in different offerings from mental health, emotional health, caregiving support, financial wellness, etc. And finally, we're recognizing the importance of culture. As your organizational culture continues to evolve, so should your well-being. And this is really just scratching the surface on the changing needs of today's employees. And while you might be sitting here thinking, yeah, Julie, that's great, but I cannot execute on all of these changes, today we're going to share with you how our dedicated well-being services team has helped so many of our clients adopt or shift their well-being strategies to support employees differently. So I want to hear from you. We're going to start here with a polling question, and we would love to know, how well did your company support well-being in the past year? Would you grade yourself? This is to grade yourself now. Would you give yourself an A? You totally excelled. You were able to pivot and offer everything and more, the star student. Maybe you're giving yourself a B. You had to drop a few things, but overall the program went as planned. Maybe you're more in the C category and your culture took a hit and couldn't do everything that you planned. Or D's get degrees, you know, were you unable to pivot and did you need to start fresh next year? You can only choose one, so take a second, pick the one that best aligns with your organization, and let's see what you guys had to say. Oh my gosh, look at this. We've got star students, we've got B students, and C. I'm glad that nobody was in the D category. That's really great. This is really nice to see, but it also just kind of shows that you would have some room to grow. So we could all use some extra help too when it comes to supporting our employees. We can have ideas all day long, but really executing can sometimes feel really overwhelming. And that's where a dedicated well-being services team can come in and help. Now, before you meet the group, I do want to just take a step back and share with you who makes up our DWS, Dedicated Wellbeing Services team, or DWS as we like to call it. First, we have our dedicated wellbeing health coaches. And these guys, they offer guidance, mentoring, and education to ensure that participants have the tools to set realistic lifestyle goals. We have our dedicated wellbeing program coordinators. This group is a combination of health coaching and wellbeing program management. And they really split their time being individual group coaching sessions and help support health and wellbeing fairs. Then we have our dedicated wellbeing program managers. And this group helps plan and execute all aspects of wellbeing program to increase engagement. They're the visible sign of commitment to your employees. And then we have our implementation coordinators. And these guys work directly with the account team during implementation to help support, strategize, and develop custom communication campaigns to promote the wellbeing program. So today you're going to meet a fabulous group of four from our dedicated wellbeing services team, and I'm so excited to introduce you to them right now. So first we have Jennifer Palenchik, and she is currently our senior wellbeing program and team manager. She has been with WebMD Health Services for 25 years, and she currently services one of our large automotive accounts. With her team, she provides well-being programs to 27 satellite locations with the help of wellness champions at these locations. Hey, Jennifer. And then we also have Colleen Faltis, and Colleen is a well-being program manager for one of our financial clients. In her current role, she works with our dedicated client and assists with the design and implementation of their employee well-being programs. Hey, Colleen. And then we also have Nikita Perryman. Nikita is the Senior Wellbeing Program Manager for one of our industrial clients. And she's been with WebMD Health Services for about 8 years and is responsible for managing her client's Wellness Champion Network. Hi, Nikita. Thanks for being here. And then rounding out our panel today, we have Gretchen Berry. Gretchen is the Director of Wellbeing Services. She is responsible for providing strategic guidance and oversight to her team of well-being managers. Gretchen, thanks for being here. Okay, we've heard enough from me. Let's get to you. Nikita, I want to start with you. And why don't you start telling us the challenges that your client was facing and how you were really able to support them?
Thank you so much, Julie. As Julie mentioned, my client is a global industrial company. They primarily provide those wellness services to their employees in the U.S., and that is about 18,000 when you combine the employees and the spouses. Now, one of the main challenges that we experienced this year was a challenge to communicate the wellness program with less on-site presence. As I'm sure many of you are probably on the phone or on our webinar today, may have worked with a high manufacturing population, or perhaps you serve a manufacturing population. And you know how important it is to have that on-site presence. These employees are looking to be able to walk over to Joey's desk and ask him a question about the wellness program. Perhaps that's just raising a hand in the quarterly safety meeting to get some assistance registering for a health screening. So when the onset of the pandemic came about, we saw a lot of our wellness champions who are typically in an HR role, maybe they're in a safety role or administrative role. A lot of them went into a hybrid role where they were working primarily at home and coming to the office on some days. And then many of them actually did a lot of remote work. So because of this, we did not, that on-site presence that we so heavily depend on our wellness champions for was just a little lower than it typically is. Now, when we put this into perspective, all of these employees, they're spread out across about 40 different states. So those wellness champions are the on-site presence that those employees depend on to know what's coming up with the wellness program, to know what's going on. And so with those guidelines that were put in place, that presence was just a little bit lower. Now, here's the thing. We have been planning some new things for that 2020 year. We were moving to a new wellness portal. Now, previously, they had been on an existing portal for about 8 years. So now we were shifting to this brand new portal. Not only that, but with the onset of the pandemic, we had to make some changes. So the program start date changed. We had to change the deadline. We also had to revamp the incentive structure to ensure that all the participants were able to complete it. That's a lot of changes. And we're looking at that many changes and less on-site presence. That posed a challenge to us. Now, let's all be realistic. I'm sure you guys here are thinking the same thing. During that program year, the priority of wellness shifted down the line a little bit. Employees and champions were more concerned with ensuring that they were implementing proper safety calls at the business, making sure that they were compliant with the CDC guidelines. They were also helping employees navigate personal lives and changes. Some of them had shortages on products that they were getting into the business, or maybe shipping delays. These were the priorities. So when you consider changes in priorities, not as much on-site presence, changes in the program, that's a lot. And these type of things impacted participation. So one of the things that we noticed was right off the bat, we had a slower start. We saw that participation was a little bit lower than it typically is at the beginning of the year. But we were determined not to let that stop us. We knew that we needed to do something quickly. We needed to adjust quickly and implement something to ensure that we maintain our program participation. So that's what I want to talk about now on this next slide. What did we do? How did we pivot? Well, one of the very first things we did was we wanted to expand that champion network. So we introduced a new role into the network, which was the backup wellness champions. So for those champions who were not on site as much and couldn't answer Joey's questions, or they couldn't walk Lily through completing the health assessment, they were challenged to find people on site who were there most of the time. We did provide communications and assist them in doing that. And over the course of the year, they were able to find 54 new people who were on site to help manage the program. So we were able to increase that on-site presence. It was a win-win situation, because what happens when you introduce new people into the network? They become more familiar with the program. They have more of a sense of ownership. They're able to recruit new people. So that was a benefit overall to the program. Then we wanted to make sure that we got all these new people. We've got these champions. We've got our HR representatives supporting. Now we've got these new backup champions. But we needed to make sure we keep them engaged, because our champion network are the boots on the ground who really help to ensure that the program is communicated effectively, that questions are answered. So we use a bi-monthly Wellness Champion webinar to relay that information to the champions. We share with them all of the updates. We give them strategies on how to introduce topics and assist employees through completing the program. So in order to, with all these changing priorities and changing in workforce, we wanted to make sure that we engage them to a point where they actually came to the webinars to hear that information. So we made some tweaks to the structure of our Wellness Champion webinar. One of the things that we did was we increased the incentive for being a champion. That helped to ensure that they would actually come and continue to promote the program. In addition to that, we also changed the structure of the webinar. So where we have been traditionally just program focused, we talked about the deadlines, we talked about strategies to get people involved. We realized with everything that was going on, people are still human. People have different priorities. So we wanted to appeal not just to the program, but to the people. So we started pulling in topics into our webinars that would really help to speak to what people were dealing with around us, the emotional aspect, the mental aspect, the social aspect. We did things like staying healthy during the pandemic, how to enjoy your family during the pandemic and be safe, how to do things you love with people you love, how to immune boosting foods to stay safe during the pandemic. These were the things that people wanted to hear. And we realized that. So we made sure that we included these topics on the webinars and we marketed them so that champions knew what they were coming to get. This actually really helped to keep champions coming, to keep them engaged in the program. We also made sure that there were opportunities for the champions to earn point themselves on the webinar. So with all the changes and not being able to get together in groups, which a lot of our programs were focused on group activities on the on-site component. So we wanted to educate the champion on how to shift some of those activities to virtual. So what we did was we brought those activities to the webinar and allowed the champions to experience them first. So things like lunch and learns, instead of giving them a document and say, here are the notes related to your people, we said, come to the webinar and let us relay it to you. So when we would present that to them, not only would they get points for participating, but they saw how easy it was to offer these activities virtually. And what we saw from this was an uptick in participation. We saw more champions recording webinars and allowing people to come to hear those things. So these were just some of the activities that we saw come about. And so in addition to that, we expanded the network, we engaged the champions, and we also focused a lot on the mindfulness activities. So making sure that champions were able to present activities that focus on reducing stress and getting the people involved, taking a break from all that they were focusing on. These mindfulness activities were things like simple as word search puzzles, crossword puzzles. One of my favorites was the Where's Waldo activity. What we did was we created a challenge where participants could participate in Where's Waldo. And of course, they had to find Waldo. And as they complete these puzzles, they could earn points for it. Well, we got some feedback from a champion. And the champion said, hey, Waldo isn't practicing social distancing. So we shared this feedback with our client, and we had a great idea. Like, why don't we put a mask, use Photoshop and put a mask on Waldo and resend it out to the group? We did that, and our participation in that mindfulness activity, because of the social distancing and the mask, doubled that year. So we had a lot of great feedback, a lot of information. And the social connectedness, we made sure that people were taking advantage of challenges that would allow them to focus on themselves. The corny joke of the day. We had a lot of different activities that they could do, posting on the My Community wall to stay connected. So all of these were just great things that we did to try and keep people engaged and keep them in the program. So I guess you're probably wondering, and you can see how things turned out. How did it work out? Well, we actually achieved the highest company-wide participation that we had experienced since the program's inception in 2012. So this was year 10, and the participation was 84%. Now, if we were to remove the new hires and those who had waived coverage, it was actually 90% participation. So in this 80,000 plus participants, we had 90% of their people to complete. That was higher than pre-pandemic. We also had a greater amount of people participating in those virtual activities. That spiked. We also had, now we've got this greater or larger wellness champion network because we expanded it. People felt a more personal connection to the program because we weren't just, wellness wasn't just a checkbox to complete or just an incentive to be earned, but they felt like the program cared about them because we focused more on the people and not just the program. We offered over 300 activities and a tremendous amount of participation. The champions were engaged, the peoples were engaged, and these were just some of the pivots that we made during the pandemic to ensure that we maintain wellness engagement throughout.
Nikita, that is amazing. And I want to reiterate what you just said, that to have the highest participation during COVID is remarkable. So kudos to you and your team. That is amazing. I love hearing those stories. And I do love the Where's Waldo. I might have to just see that because I like Where's Waldo. Thank you so much for sharing. If you guys have questions for Nikita, again, just add them into that question box. We'll have time at the end to go through with them. I now want to pass it over to Colleen. Colleen is going to share some stories about how we were able to work with one of our financial clients that needed some help communicating to their large employees. Colleen, take it away. I think think you might be still on mute, Colleen. Okay, we're going to get to Colleen and figure that out. So Jen, stand by. We're coming to you next. So we'll come back to our financial client here in just a second. Jen, I want to pass it over to you. As a reminder, Jen is our automotive. She works with our automotive client. And they needed some help when it came to a vaccine initiative. So Jennifer, do you want to take it away?
Sure. Thank you, Julie. Good afternoon, everyone. I'm excited to talk to you all today about my client and our flu shot campaign that we launched in 2020, so we had to make due to the pandemic. My client is a large auto manufacturing organization with approximately 60,000 employees all across the U.S. The majority of the employees have been working on site throughout the pandemic. However, we do have a select population, roughly 15,000, working remotely. My client wanted to ensure that their employees had all the necessary means to help stop illnesses spreading in the plant as well as at home. At this time, there was no COVID vaccine. Our thought was if a flu shot could help provide added protection for employees and family members against illness, as a company, we would make every effort to provide employees with as many opportunities and outlets to get our workforce and their family members vaccinated. Our planning focused on 4 areas. We had planning and communication, implementation, and our metrics. First, we developed a work group that helped us bring this program to life. Internally, our COO encouraged us to make this happen, not only in the plants, but for the remote workers as well. The DWS staff partnered with HR benefits, employee health and safety, security, facilities, plant management, our UAW locals, and communication personnel at each facility to plan and promote our events. The support of the plant leadership to give employees time off of the line to attend these events was well supported and communicated. Externally, we had to work with a variety of vendor partners to bring these immunizations to our facilities. Our clients' family health centers, Beaumont Hospital, Quest Diagnostics, and our plant medical, along with our pharmacy benefit managers and our insurance carriers, helped spread the word, but they also helped gather metrics for us. The work group took a look at each and every location to determine what type of event we wanted to have. Could we partner with our on-site resources, such as a plant medical office? And in those locations where there was no plant medical, could we use an outside vendor to come on site? Regardless of who was doing the flu shot administration, we needed to make sure that we had the proper equipment on hand to host a safe event. PPE was a must, as well as social distancing employees as they came to get vaccinated. Our local employee health and safety representatives were a huge help in making recommendations at each plant on where we could hold the events and helping to provide us with signage for social distancing. In our planning, we also remembered we have this remote workforce, which is located in one specific geographic metro area. We were brainstorming ideas on how we could include them in these events and possibly reconnect them to work locations that they had not been to in over 6 months. We also decided, since so many family members, spouses, domestic partners, and kids were working or schooling from home, we should also include them as well. This is where our drive-through flu shot clinic came to be. We knew that we could not have these employees that were working remotely or their family members come into the building. So we needed to find some central locations that we could offer flu shots at for our remote workforce. We decided to host a few days in an unused parking garage at our corporate headquarters and another location that was approximately 30 minutes away. And this location was very central to many of our plants in that metro area. The other things we had to look at were some of the logistical things that we needed for hosting these events outdoors. We needed tents, we needed power to these areas for lighting, our computer plugins, heaters for the workers that were helping out at these events, and we needed restroom facilities nearby for the workers. On the days of the events, we needed to make sure we had a variety of things planned out to make sure that our events went smoothly. We needed signage directing people where to go. We needed to control traffic in traffic flow. About where to enter and where to exit for these events. We needed to have registration personnel that were writing in the names of all of our participants, checking temperatures of everybody, and making sure that we asked our COVID-related screening questions to employees to make sure that we could proceed with giving them a vaccination. We also had to make sure that everyone in the car who was getting the vaccine was properly masked before we sent them on to the next station where they would get their flu shot. And the last thing we had to worry about is for the employees that were getting a flu vaccine for the first time, we needed an area that was our observation area where they could park their car, wait 15 minutes, make sure there was no allergic reaction, and then we could send them on their way. So that was no easy feat for us to do all that planning, and getting all the participation that we wanted to get took great communication strategies. We worked with our plant communicators at each of our locations to put up digital signage or put up posters around the facilities on how to sign up for appointments for those on-site events. Emails were sent out to the employees working remotely with directions on how to schedule appointments for themselves and their family members. Home mailings were sent out by our pharmacy benefit manager to all employees with a reminder about where you can go locally if you're unable to attend an on-site event. Lastly, word of mouth the day of the events was a big help. Our wellness champions were the ones that walked the plants, let employees know where we were, how long we were going to be there, and when we would be back. As you may have already heard, my client is an auto manufacturer. We wanted to do something a little bit extra that we could get employees to feel engaged since they hadn't been on site for so long. So we thought it would be cool to offer a mini car show on display for employees as they came to these drive-through events. Cars on display, some were located at the entrance of the event, some were located along the lanes where people were waiting to get their flu shots, and it just provided an extra connection to them about the company they worked for, but it also gave a distraction to the little ones in the car that wanted something cool to look at as they were waiting with their mom and dad to get their flu shot. We received many complimentary emails and phone calls from these employees thanking us for all of our efforts to make them feel included and for allowing their families to participate in this event with them. Finally, I want to go over our results with you all. The success of this program was due to the support of many different groups, as I've explained earlier, both internally and externally. We vaccinated 8,145 employees at our on-site events, and of those, 1,800 attended our drive-through events. It is also important to remember that approximately 28,000 employees were still able to get the flu shots at their local pharmacies or their doctor's offices. In total, we vaccinated 36,424 people during our 2020 campaign, and this was about a 50% increase from the previous season's flu shot participation. In closing, the success for this program was so great, our client decided to follow a similar strategy for this year's flu shot campaign. Thank you so much for your time today.
Jennifer, that is fantastic. Those are great metrics, and I think it just really goes to show having the idea and then the execution can be super overwhelming. So kudos to you and your team. And not to get pressure, but I did see, I think one of your clients is on the webinar today too. So that was great. I'm glad that they were able to join. Okay, I think we've got Colleen back. Colleen, can you hear me?
I can. Can you hear me?
Yes, we've got you. All right, that's awesome. Okay, let's kick it over to you. So as a reminder, Colleen is going to talk about one of our large financial clients and how they needed some extra help communicating with their large employees. So Colleen, take it away.
Great. Thank you so much, Julie, and thank you all for joining this call today. As the intelligent and strong-willed Helen Keller said, life is either a daring adventure or nothing at all. I would certainly agree that these last 2 years have been one of curious adventure and experimentation, adversity, resilience, and growth. For many of you on the call today, you may have shared experiences of the tribulations you have had to overcome to continue the pursuit of excellence in well-being program design and execution. Just like you, the large financial services company we serviced had their fair share of challenges as well, from transitioning to a 100% on-site well-being program delivery model to a 100% virtual well-being program delivery model, to choosing an optimal technological platform for program delivery. And certainly after this example, I don't have to go through the tech challenges over the last 2 years. And then certainly authentically connecting with a workforce that was now fully remote. We too had our fair share of challenges. However, during the last 2 years, these trying times provided us the opportunity to think and respond differently. We were nimble in mind and in program execution and awake to the ever-changing needs of the employee population. We will discuss how our client pivoted not only to adjust to the virtual work landscape, but provide well-being programs that cater to the vastly different and complex personal and professional situations the employees now found themselves in. Our client faced the challenge of change head on. This vigilance required flexibility in program design and modifications to the annual well-being program strategy, including rethinking monthly well-being themes and programs that fit with the times. Additionally, the client kept a careful pulse on the challenges employees were now facing while working from home, such as working parents navigating homeschooling and a now virtual education model, to caregiving from afar for employees that couldn't quite travel to loved ones and care for them in a way that they would like, to social isolation for employees that were now working from home alone and really fostered a sense of social connectivity in the office. In addition to these modifications, the client also implemented a few other strategies to ensure the well-being experience created a sense of support, connectivity, and normalcy through these changing times. One of the new strategies included offering programming to all 200,000 plus employees across the client blueprint. This was a monumental shift from pre-pandemic, where our programs were primarily offered at the 3 large client sites here in North America. With the use of internal technological platforms such as Skype and MS Teams, the virtual well-being program delivery model gave us the opportunity to access and reach thousands of employees across the globe, which led to increased engagement and participation in our programs. For example, in our second annual virtual 5K in 2021, we had over 2,000 employees that registered for and participated in the 5K, from runners, walkers, and joggers to rowers, even water skiers and wheelchair athletes. This program represented 38 US states, India, and the UK. Another strategy we employed was creative program design that was suitable for virtual delivery. This in turn allowed us to curiously explore the depth and breadth of virtual programming. In 2021 alone, 11 new programs were implemented for the client. This included, but was not limited to, our Strides for Impact Challenge, which was a physical activity-based challenge with a collaboration between our partners Rally and the philanthropy and sustainability teams. We also offered weekly meditation and yoga sessions, an embodied presence and emotional first aid presentation, a loving kindness activity calendar, and then of course our well-being tapestry program, which allowed employees to complete a virtual well-being tapestry of lifestyle medicine practices that help them optimize their well-being. In this program, we exposed employees to the various elements of lifestyle practices that they might not have otherwise tried. And that included an ecstatic dancing session, a plant-based cooking session, mandala creation, a sound bath meditation, and a watercolor painting session. Lastly, we worked very closely with the internal vendors at the client site to offer educational webinars, which amplified our well-being offerings. The recent Managing Difficult Emotions presentation had 713 employees attend, and the Parenting Your Parents webinar had 519 employees in attendance. These numbers are a testament to the crucial role our vendor partners play in program design and delivery. So it certainly goes without saying that our communication strategy was also instrumental in the engagement and participation we saw in the programs. During the last 2 years, we had to drastically shift our communication strategy from one that was in-person, high-touch, to one that was all virtual, requiring the use of email and an internal social platform to get the word out about our programs. And of course, in a virtual world where an employee's inbox is flooded, what do you do about that? Here are some communication strategies we implemented. So the first was consolidating our distribution lists. We consolidated our distribution lists across the 3 large US client sites and created a very brief survey for employees so that they could sign up for our monthly communications and then, of course, be added to the distribution list. With persistent and regular communication and word of mouth, our distribution list grew from 8,000 employees to a whopping 20,000 plus employees who now receive our monthly well-being newsletter from our central well-being mailbox. The branded and consistent messaging helped employees link the communications with the well-being work we are doing. And just a few things to note about the communications. The timing of the newsletter communication was part of our strategy as well. So sending out those communications first thing on a Thursday or Friday morning ensured that more employees were reading those communications and in turn taking action by adding those events to their Outlook calendar. So sending them out on a Thursday, Friday morning as opposed to a Monday was part of our strategy to ensure more eyeballs were on our monthly newsletter. In addition to that, we followed up 2 weeks later with an in case you missed an email for employees that may have been out of the office during the time we sent the first monthly newsletter. So sending a follow-up email to remind them of the monthly events also increased participation. We also shortened our sessions and started them 15 minutes after the hour, recognizing that the length of the sessions can be part of a well-being strategy as well. So providing employees time before and after a meeting at the top or end of an hour to really just focus on themselves, take a deep breath before they transition to other calls during the morning or afternoon hour. And then one other thing that's been useful in our communications is adding an add to calendar feature for all well-being events. So rather than exporting those events from the internal social platform, they can add that event right to their calendar from the well-being newsletter. The second strategy we used is internal social platform. The client has an internal social platform that we use for communicating and scheduling events. Because we use this as a central hub for all of our well-being communications, employees then recognize that as a central hub for all things well-being, and we were able to add an additional 2,000 employees in 2021 alone. So really leveraging any social hubs or central hubs you may have from a social standpoint to schedule events, upload well-being recordings, or even blog posts can be instrumental in knowing that employees, especially if you have a lot of internal sites, employees know that there is this central hub for well-being. We also leveraged our well-being champions. We have consolidated our well-being champion network of champions across the U.S., and they were instrumental in getting the word out about all things well-being. And then last but not least, managerial and executive level support. Managers on a frequent basis reach out to us to offer programs and services to their team. So from stretch breaks and meditation sessions to stress management and healthy meal planning presentations, these sessions connect employees to well-being and help them better understand what services we provide to them. And then certainly a big win for well-being this year was having the COO at the client site send an email that was solely about well-being week to all employees at the client site. And we certainly saw an uptick in participation and engagement after that email was sent out. And then lastly, in addition to our ability to pivot and remain versatile in the face of hardship, the creativity in program design, a robust communication strategy, and high-level managerial support has led us to where we are today, with 300 plus programs offered this year, engaging 67,000 plus employees and a distribution list of over 20,000 employees. A virtual well-being model can provide so much value, support, and many moments of ease and respite to your workforce. I wanted to leave you with this note of thanks sent to us from an employee. Thank you for everything you do. It is one of my favorite parts about working here, and it makes a huge difference in my holistic health. This truly speaks to the collective work being done at all of our client sites. The work is seen, valued, and provides a bit of normalcy in times of so much unknown. So thank you for providing us the opportunity to do the work we do.
That is awesome, Colleen. Thank you so much for sharing that. And it's even more refreshing when you actually get the quote from an employee who you actually really helped. So that's great. Thank you so much. Okay. Got some questions coming in. The first thing that I want to address just really quickly off the top is I told you we're going to go over a lot of information. We are, and you guys are going to get this recording in the coming days. So it should be in your inbox tomorrow, so you can go back and listen and get the slides. We also have some additional resources that are listed there on the homepage as well. You'll see in the bottom right corner. We have, and one of them is an ebook to our coaching, which can also give you some ideas. We have some questions coming in about our Wellness Champion Network and how to create a Wellness Champion Network. So Gretchen, I want to hand it over to you because while we've just scratched the surface on everything that is offered, there's also a couple of things to remember. So maybe you can walk us through those.
Yeah, thanks, Julie. I'd love to. So when I think back to March 2020, when the pandemic began and our very large DWS team of literally over 100 people had to switch from being physically on site daily to working remote from one day to the next, we honestly weren't sure what to expect. So I challenged the team to pivot, and you've heard some of those stories already, and really wanted to ensure we could find extra creative ways to still do our jobs and also support our GWS clients. So some of the additional stories that I'm going to share with you today will show how the team did just that. So we've talked a lot about Champion Networks already. And the reason for that is because Champion Network support is a very large part of our DWS team members' roles. So when we could no longer go on site to lead our monthly champion meetings, we decided let's keep the meetings and simply switch them to video so that our current champions could still physically see us and stay connected, because that face-to-face connection just makes such a tremendous impact. One of our on-site teams actually decided to implement a curbside promotion where the employees could drive up and stop by at a safe distance and still learn from us about the Champion Network and then, of course, the Wellbeing Program as a whole, which was very beneficial. Many of our DWS clients, as Colleen mentioned, also have their own internal social media pages. So we were able to leverage those channels to promote and also recruit even more champions. And the Facebook Live feature helped us gain a lot of traction. So honestly, some of our most successful events were implemented in that way, like virtual walking with your wellness coordinator or cooking at home with your wellness coordinator because we're all at home. And then even for a little zen, creating some art with your wellness coordinator. If we talk a little bit about incentives, when you're thinking about incentives, it's important to know what your employees want. What is it that really motivates them? So we found that utilizing even a quick pulse survey is a really great and honestly easy way to gather that direct feedback. And in pulse surveys that we've conducted so far, the results have shown that the employees are not necessarily motivated by monetary items. It can be things as simple as, a new pair of walking shoes or running shoes, workout gear, or even fitness equipment for the home, reduced gym costs, and even things like virtual fitness classes, because a lot of those are happening right now. And webinars. So pre-pandemic, webinars were a commonality for our team, but honestly became increasingly popular when the work sites were shut down, because it was still a means of being able to communicate and really stay engaged. So when planning the webinars, we wanted to make sure that they were educational, but also fun, so that people didn't think of them as just joining another meeting. So throughout the pandemic, we actually started referring to them as daily or weekly wellness breaks, because they could even be just a quick 15-minute session that allowed the employees to do somewhat of a mental checkout and then also have fun with us in the process. A really unexpected and equally amazing outcome that we learned when conducting the daily wellness breaks was that we started to hear that kids were joining and other family members began to watch and join in too, because everybody was at home together. If we talk a little bit about virtual team building, these types of events and activities started to become very popular with so many clients still remote. So we implemented a variety of virtual activities to help keep the employees further engaged. So we added some things like virtual well-being and steps challenges that, really still helps foster that friendly camaraderie between the employees, and then also help them to focus on improving their mental and physical health in the process. We even added in some fun and slightly different initiatives like coffee chats with our health coaches, or virtual well-being Jeopardy games, where we tied in some incentive-related questions. And then even, celebrating big wins or milestones for your employees with a virtual happy hour. All of those were really great and fun initiatives. If we look back at some of the new programs and even vendor launches, interestingly, we saw that just because the workforce doesn't exactly look like it used to, actually doesn't mean that people aren't adding additional vendors or even switching programs entirely. So with any of these changes or additions, though, we did see an increased need to ensure each was communicated well, as Colleen spoke to earlier. So just as an example, since the acquisition of Staywell in 2020, we've had a large number of our Staywell legacy clients transitioning from the My Staywell platform to the WebMD One platform. This was obviously a very big change, and so we still needed to be able to support them and teach and even show some of the employees really how to navigate those differences. So one way we did that was by introducing a how-to series of support, which really focused on a number of different topics, depending upon if it was a new vendor or if it was a new program. We were then able to utilize this series format for the My Staywell platform transitions to the WebMD One platform. And it was nice because it then walked the employees through the new portal and then listed out FAQs they could always refer to afterwards. So overall, I've been asked really a number of times since the pandemic began how the DWS continued to do everything they normally did daily. How do we continue to support our clients? And, in a time of so many unknowns for everyone, we just knew we had to be that much more nimble, that much more flexible, innovative, and even more supportive. And the feedback that we received from the participants and employees was that these simple yet fun activities like our daily wellness breaks was something that they could control in their lives, and honestly what they looked forward to every week. And really the overall results have showed that our DWS team can always support and continue to share new and creative ideas and really adapt to the changing landscape, whether that's in person, whether that's virtual, or it's a mix of both, which we're seeing all around. So I'll turn it back to you, Julie.
That is great, Gretchen. Thank you so much for sharing. I know there's so much information to cover. We could have made this a 4-hour webinar today. So thank you so much for sharing that. Okay, now we have time for questions. This is my favorite part of our webinar. We've already got some coming in. Gretchen, I'm gonna actually just kick it right back to you. This one is about the wellness breaks that you were talking about. Do you have some examples to share about different wellness breaks?
Yeah, absolutely. I think some of the most common topics that we saw and started to implement were things like just getting organized while working from home. Many people had never worked from home before, including our own employees. And so, we wanted to be able to help them get and stay organized. Family nutrition was crucial. And what was nice with that particular topic was that we could bring everyone to our own home kitchens. And a lot of our program managers and coordinators did somewhat of a teaching kitchen from within their own home. And that's where I referenced earlier, the kids and the other family members were starting to see that and loved it and kind of gravitated toward it. So we said, let's bring the kids. Absolutely. Let's do these recipes together. And then I would say the third biggest and most popular was workouts and exercises that you could do in your own home that required little to no equipment, like, chair yoga, or we would tell people, go grab some empty gallon jugs of that, used to have milk or orange juice in them and replace it with water and use those as free weights. Some of our program coordinators would actually show some instructions using a backpack and putting some, equipment in it to make the backpack heavier, and showing lunges and stretches and squats and things of that nature. So those three areas were definitely the most common.
Great. Thank you. Colleen, this question is for you, wanting to know if you can elaborate on the Parent Your Parents webinar.
Sure. Thank you, Julie. So this was a webinar that we had collaborated with an internal vendor partner. LifeCare actually was the vendor that provided us a speaker for this session. It was a 60-minute webinar related to parenting your parents and thinking about the financial concerns you may have as your parents get older, caregiving from afar, any health issues that your own parents may be experiencing and how to navigate those, as well as finding the right support either through LifeCare or community resources to ensure that as your parents age, that they are aging well and they are well taken care of.
Great, thank you. Nikita, this one's coming to you. We've got a lot of questions around this. So what defines a wellness champion, and maybe what process did you use to select your well-being champions?
Sure. Thanks, Julie. So the wellness champion is essentially a volunteer employee who has agreed to help promote the program. They support their on-site employees, and when they are attempting to complete wellness activities, they serve as sort of an advocate for the program. They are encouraging people to participate. They are actively participating themselves. They also recruit feedback from employees. So what do employees think about particular programs? What are some things that we can do differently to make the program even more accommodating for the employees? They meet with us and share that feedback. And they are also sharing with their leadership what the program is doing, the objectives. So they're responsible for just disseminating all the wellness information to the employee population. Now, you asked the question, Julie, what it takes to, or how do we go about determining who those people were? Well, particularly with my client, we work directly with our human resources department. So the human resources would go out to speak with the employees. We typically create a wellness champion responsibilities document so that employees would know what's expected of them, approximately how much time would they be committing to it, what it looks like to be a champion. And so we will provide that information to them in different formats to relate to the employee population. And at that point, they would go about either receiving a recruit or selecting a volunteer to be a part of the network.
That's great. Thank you so much, Nikita. And another question that came in asked if we had any handouts. For that, I will just give a little plug because I wouldn't be a marketing manager if I didn't. You can go to webmdhealthservices.com, and up at the top, you can click under resources. And we have an ebook. We have a Wellness Champions ebook in there as well that you can download that gives you a bunch of different information. We will also add a link to that ebook in our email with this recording. So it's just going to be just a little Christmas present of information for you about our Wellness Champions. So there you go. Jen, this question comes to you. You talked about the flu shot clinic that you did. Are you planning on doing the same thing for COVID vaccines?
At this time, we are not. We are basically at the mercy of the vendor that's coming on site with the vaccine, because they have to follow their protocols as a health system. So sometimes those companies don't allow the vaccine to leave their facilities. So right now, at this time, we're not exploring it. But if things start opening up where it is available in more locations, we would be able to explore doing that.
Great. Thank you. Nikita, this is a question about the Where's Waldo campaign that you were talking about. Was that, did your team own the entire execution of that campaign?
So thank you, Julie. Our team actually owned coming up with the challenge and putting it together in a simple template that champions could use. But believe it or not, the champions were responsible for disseminating that to the employee population. So we created, we found that our champions really like verbiage. They like talk tracks. So we created an email template where they can introduce it to the employees. We created the documentation and the resources that they need to give it to them. But the champions were the people who were actually presenting it to the employee population to complete it. And then they returned the completions back to us to award incentives. So it was a combined effort between the DWS staff as well as the champions.
That's great. So that champions, it should just been called the Champions
Yes.
webinar. Yeah, that's amazing. Fantastic. Okay, and then we just had another one about the recording of the presentation. Yes, again, there will be a recording of this presentation that will show up in your inbox in the next couple of days. Okay, to end this, I want to kind of do a little round robin style for each one of you. And Gretchen, I'll start with you. So let's go, we'll go Gretchen, Jen, Colleen, and Nikita. So Gretchen, if you could say, what is your top well-being goal for each of your clients in the next year? And what is it that you would like to help them achieve?
The top well-being goal, I think that it's so important, of course, to see the improvements in our lifestyles, right? But another added caveat is the fun feature. And I think over this last year and a half, we have seen so many smiles and so many families and kids having fun because of what we've been able to bring into their homes in a virtual capacity. And you have to have that fun component to keep the people engaged. So that's crucial. And what was the second question, Julie?
And the second question is, what do you want to help them achieve?
Well, of course, we want to help them get the engagement results. And with our dedicated team members, we're going to help you do that. As you heard from the stories today, it's just phenomenal to see that it doesn't take that much or even an astronomical type of change to get people engaged and keep them engaged. And, you know, especially with this team still embracing this hybrid environment we have going on now, balancing both being on-site and remote, we can help the employees get and stay engaged in all of their well-being offerings.
That's great. Thank you. Jennifer, what about you?
I believe for us, we're working this year on refreshing and rebranding our wellness champions on site for our clients. So we're going to have a bigger push on formalizing the wellness champions, because during the pandemic, we lost a lot of employees, left the work sites, or, our work sites changed where we have a lot of people working remotely now. So trying to work on keeping all of those remote people connected as well, I think would be definitely one of the things we're going to be working on in 2021.
Great, thanks.
Or 2022, sorry.
Yeah, let's not go back in time, Jennifer, please. Colleen, what about you?
I would just say, just making sure that the employees feel seen, valued, comforted, and cared for as we head into another transition period, the return to office. So ensuring that they're cared for during that time and meeting them where they're at, just like we did in 2021, knowing that their well-being journey through this transition period may look a little different in 2022 as well, and providing creative programs to adapt to those changes.
Great. And Nikita?
Very similar to what I've heard thus far, maintaining what we have already established in 2021, retaining those virtual options, continuing to have a focus on meeting people where they are, just being human, helping them with resilience, bouncing back, knowing that they're valued and they're important, and really continue to establish that social connectedness. And from a program perspective, how we're going to help our client do that is we're going to help build the incentive structure around those type of things that is proven to be effective in getting people to participate. So we want to maintain that and just continue to explore options from an incentive perspective to reward people for practicing to live the life that they love. That's what we want for the employee population.
I love that. That's fantastic. That is a great way to end. I want to say thank you so much to our amazing panel today for spending the hour with us, and to all of you and our attendees for being here with us. Just a quick reminder, there's going to be a survey that's going to pop up right after, so don't close out your window. We would love to get your feedback on this webinar, so we will use it when creating all of our future content. We want to wish you all a very safe and happy holiday and a wonderful new year, and we look forward to seeing you all again in 2022. Take care. Thanks again, everybody. Bye-bye.